Before you treat typhoid, let me tell you why that Widal test that you did might be lying to you. You see, in Nigeria and many other countries, Widal test is almost like a routine blood work. You walk into a lab with fever, and before you even say good morning to the lab attendant, they've already suggested Widal test for you. But the problem is, Widal test is one of the most unreliable tests that we still use today. Let me tell you why. Number one is that it gives too many false positives. You see, Widal test doesn't look for the actual typhoid bacteria itself. It looks for the antibodies against this bacteria, but those antibodies can rise for many completely unrelated reasons. If you've had typhoid months or years ago, it will show. If you've taken the typhoid vaccine, if you probably had another infection, or you were exposed to a related bacteria in that same environment. So the test will say positive, meanwhile your real problem might actually be something else, like malaria, like viral illnesses, or even stress. You see, that's how people end up taking antibiotics for what's not actually typhoid, causing resistance. Number two is that there is no standard baseline in Nigeria. For Widal to work, each region must actually know the normal antibody levels for healthy people. But we don't have that. So an antibody level that means nothing in Lagos might look like severe typhoid in Enugu. So one lab is saying 1/80, another one is saying 1/160, another one is saying reactive. So which one should we actually believe? Number three is that many of these kits are actually poor quality and they react to almost anything. See, some Widal kits that are sold in the market are so sensitive that even mild infections can trigger a forced reaction. Which means people will end up taking 3 to 5 antibiotics, unnecessary injections and drips, and still no improvement, because the problem in fact was never even typhoid in the first place. So which test actually works better to detect typhoid? If typhoid is truly suspected, the gold standard is a blood culture or a stool culture, and most importantly, a proper clinical assessment by a trained qualified doctor. You see, these two tests detect the actual bacteria and not just the antibodies floating around from last year or 2 years ago. So next time someone hands you a Widal test to do, don't panic. Ask them questions. Why are you doing this test? Ask for a proper test to be done, because your health is actually very important to diagnose based on just guesswork. So please stay informed and stay safe.